Good afternoon. You're watching AB Live, and today we are going to be discussing a very important topic, which is mental health in the time of COVID-19. If you do have any questions regarding this, just post them in the comments below and we will take it here with Dr. Sarah Rasmi, the Managing Director of Thrive Wellbeing Center. Thank you so much, Dr. Sarah, for joining us.
Thank you for having me.
Dr. Sarah, I'm sure this is a very busy time for you, but I want to know, is this one of the busiest times you've had where you've had a surge in clients and new patients coming to you?
It absolutely is a busy time for us because a lot of people all over the world and here in the UAE are struggling with things like stress and worry and anxiety, productivity issues around working from home, helping children adapt to their e-learning and being at home as well, and also maintaining social relationships during this period of physical distancing. So it definitely is a busy time.
Right. What would you say is the one thing that people are finding most difficult? Is it the social distancing, quarantining element of it? Is it the fact that the entire family is at home and they have to teach their students with the e-learning and all of that? What exactly would you say it is?
I think broadly the biggest issue that people are facing right now is the fact that this is a time that is just so full of novelty, uncertainty, and ambiguity. We've never really experienced something like this before. It's very difficult to predict where we're going to be in a month's time or even tomorrow. And so when we find ourselves in a situation like this, what typically happens for us as adults and for children as well is that anxiety, stress, and worry start to breed. So that is definitely the biggest thing that we are noticing. And honestly, before the situation, it has been one of the biggest things that we see, but it has taken sort of a different twist since the COVID-19 pandemic has begun.
What do you mean by that? That before this, you had also seen a lot of these cases. Do you mean that there was a surge already before the pandemic even happened?
Yes, so anxiety is one of the two common mental health challenges, and it's one of the main things that we see at the clinic. So that has continued and persisted. What I mean is that the nature of the anxiety has shifted. So whereas before, a big part of it would have been around relationships and work, and to be fair, those are still big concerns for people, but a lot of them now are due to the factors that come along with the COVID-19 pandemic. So what you were referring to a little bit earlier with being under quarantine, the transformation of our social relationships, having to wear so many different hats at home. Of course, given the nature of the virus, a lot of people are struggling with health-related anxiety. So the baseline is the same in a lot of ways, and that anxiety is the main presenting concern, but there are just different elements that have come to the forefront as a function of COVID.
For sure. So what would you say are the main issues that people are suffering from right now in terms of mental health?
Definitely anxiety, and I think a lot of people are experiencing issues in their social lives as well, because as you know, we have restrictions and physical distancing is an important part of that. We know that social connections are vital for our well-being, and that's been documented in a lot of research. And inversely, we know that social isolation can be problematic. So a lot of people, particularly those who may be at home by themselves, are experiencing some level of loneliness. But even people who are in a house full of others are a lot of times experiencing an element of disconnection from themselves because they are not really getting the time and the space on their own that they would have had if they were still leaving the home to go to the office, to go out in the community, and so on and so forth. So there are a lot of social challenges that people are facing during this time as well.
For sure. I just need to remind our viewers again that we are taking questions from you. So if you do have any questions about mental health that you'd like Dr. Sarah to answer, then just post them in the comments below and we will take them. So Dr. Sarah, you did mention a number of issues that people are facing, but how is it that they can cope with these anxiety issues, especially when they're staying at home alone all by themselves?
So there are a lot of evidence-based interventions, and the ones that we typically suggest are those that are grounded in cognitive behavioral therapy techniques.
Mm-hmm.
But before getting into that, I think one of the most important things that we can do is try to make sure that we are maintaining a healthy lifestyle.
Mm-hmm.
So trying to have a reasonably good sleep routine, it's really important more than ever before that we stay active. And I know that the two things that I just said come with a whole host of challenges.
Yeah.
But usually what I recommend to clients and people in the community is we don't have to radically transform our lifestyle, but what we can do is we can put on our scientific hat and we can experiment. We can try to follow a healthier sleep routine. We can try to work out a few days a week, and we can pay attention to how we feel before, during, and after. And if based on the data that we collect, we determine that this is something that is good for our well-being, then that can serve as motivation for us to continue to do that and hopefully build the habit. So certainly improving our lifestyle is really important, and there are lots of ways we can make do given the limitations. There are all sorts of exercises out there that you can do without any equipment whatsoever. And there are a lot of things, and we have lots of resources on our page, but there's a lot of freely available stuff elsewhere around how to have better sleep hygiene. So I think that those things are really important.
Right, I think this is the first question that we have from one of our viewers. Reem asks, are there any exercises we can do for stress relief? So would you be able to recommend any exercises for stress?
So I think it really depends on what makes us feel better. So what I would invite your listeners or viewers to do is to reflect on what brought them a sense of relief prior to the situation and to try to replicate it within the parameters that we're under right now. Some of the things that we know are helpful is trying to maintain contact with people. But I think if I had to give one tip, it would probably be for all of us, particularly those of us who are living with another person, to make sure that on every single day we get some period of time, whatever we can manage on our own, to do whatever it is we need to do, even if it's just to stare at a wall. Because as I alluded to earlier, it's really important for us to stay connected to ourselves, particularly in a time of such uncertainty. So self-care is whatever you think it should look like, making that a priority, but also trying to do something independently if you live on your with others, and if you live on your own, trying to maintain some level of social connection is incredibly important also.
For sure. So I think right now, Dr. Sarah, you're talking about well-being mainly, but there definitely is a difference between well-being and, just not feeling good mentally compared to proper mental health disorders which are diagnosed, right? What I really want to know is there are a lot of people who are confused about if this is just a state of mind right now because of the things that's happening, or if it is a serious disorder and a health issue. So at what point do you say that it is time to get medical help?
I would say that first of all, it's important for people to understand that if you are experiencing symptoms of things like depression or anxiety, you are definitely not alone in general, and you are certainly not alone now. So what I would do is I would think about how long these symptoms have been persisting, and I would pay attention to how the symptoms are impacting us. So one of the things that we look for when we are making diagnoses is whether there is some kind of significant negative impact to our different roles. So for example, let's say that you are feeling stressed and worried. I don't think there's anybody on the planet, or very few people, who can say that they're not experiencing that right now. But if you're experiencing it all the time, all throughout the day, about a wide variety of issues, and it's to the point that you are unable to do the work that you need to do, to take care of your home the way that you normally do, to connect with other people for a significant period of time, if you notice that impairment, then it's important to reach out to a professional, because one of the things that we do know from a lot of research is that mental health promotion is great, but if we are going to support somebody who is experiencing a mental illness or challenge or disorder, early intervention is best. So rather than waiting to see how things play out, it's a good idea if what I'm saying resonates with you, to reach out to somebody and just check.
I mean, it can be a little tricky right now given the situation, right? Because there are people telling us that move out or get out of your house only for essential purposes, and people also want to try and avoid going to hospitals, clinics, doctors, etc. But again, the stress levels are really high, anxiety levels are really high, and depression levels are really high among people. So I think it's about just people wanting to know where is it that the line has been drawn between it being, something that you can cope with on your own at home, and when is it that you need medical attention. So Sorry, I just have a few more questions coming in.
Sure.
So we have Mary, who's asked, I feel disassociated due to the lack of social contact. What is it that I can do to feel better?
So it sounds like she has identified that there is a discrepancy between how much social contact she's getting and how much social contact she would desire. So I think what I would suggest is starting to reach out to people in her network with whom she feels particularly close, or people that she misses. And I think that one of the things that is really important for us to be mindful of when we are having our social interactions is that they are not fully dominated by COVID-19 related discussions, because a lot of times what can happen is, yes, we're connecting, we're talking to somebody, but it's just adding fuel to some of the stress and the worry that we're experiencing. So it's a good idea to try to have a little bit of a balance in conversation so that this doesn't take over. But I just want to say one quick thing, just in case people that are listening are unaware. Right now, what a lot of clinics are doing is the services are actually being offered remotely for the reasons that you described, in order to protect people's health and well-being. So if somebody thinks that they need support, you don't actually even have to leave your home to be able to do that.
Right, so can you tell us more about this in terms of what Thrive is doing? Are there telemedicine, telehealth facilities that are being provided?
Yeah, so we moved exclusively online at the end of March, and I took that decision because I wanted to protect everybody's health. And we've been using a couple of different platforms that are all HIPAA compliant, which means that they meet international standards for data privacy and security when it comes to healthcare services. The procedure is very, very streamlined. It's exactly the same thing as anybody who would come in person to the clinic. The only difference is that you dial into the session with your cell phone or with your laptop. And for people who are struggling, we also have on our page a COVID-19 resource hub where we have a number of different things. People can even take screener tests to see their levels of depression and anxiety before deciding whether or not they want to seek support. And we have downloadable things. I was saying, having social interaction with people, not just about COVID. We have a child psychologist develop some conversation starters we can have with kids. We can use them with partners. So we've got a lot of downloadable tools and resources there as well, as part of our way of supporting the community more broadly, in addition to the mental health services that we always offer.
For sure. One of the other important points you just mentioned right now is information anxiety. When you talk to your friends and family, to not talk about COVID-19 too much, because I think that is one main conversation that's dominating all of our chats, even with friends and family. But is that a thing now? Is that a fact right now, where information anxiety is something that people are suffering from? And does this mean that people should completely stay away from social media for their news and information?
So there is a bit of information overload, and I think what ends up happening is, when people are feeling really, really stressed, they don't necessarily vet things in the way that they normally would. So somebody will see a headline, and then that person will forward it to all of their WhatsApp groups, and then it will continue on and on. And so we're getting bombarded all the time with the same message over and over again. Usually it's one headline in multiple forms. And that just maintains COVID-19 as top of mind. Yeah. And obviously, it's not something that we can ignore. It is everywhere. But if we can limit it, particularly if we're finding that it's interfering with our well-being, disrupting our sleep, then that is something that we want to do. And so I've suggested to some of my clients, and honestly, even some of my friends and family members, that if you find yourself in certain situations, whether it's using social media like Instagram or Facebook or WhatsApp groups that are just making you feel worse rather than better, then trying to assertively tell people that, you know, we need to have a little bit of boundaries and parameters around how much COVID-19 information sharing there is usually a good first step. And if that doesn't work out, sometimes people aren't receptive to it, then you need to do what you need to do. And that unfollow or mute button can really be your friend.
So it is about taking those assertive measures and saying that, you know, right now is the time to stop if it's really hampering your mental health. Again, just taking a few more questions. We have another viewer who's asked, how do we manage all our roles without losing our mind? Mom, wife, work, teacher, cook, etc.
Oh, it's so hard to wear so many hats. And I think a lot of people feel like they're wearing so many hats and not wearing any of them particularly well. Yeah. So I think the first thing, in addition to making sure you have some time to yourself to recharge a little bit, is managing expectations. Mm-hmm. We have been thrust into fulfilling certain roles that we didn't sign up for or train for. And as a result of that, we're not going to necessarily be the best and the brightest, and that's okay. So if we can practice a little bit of self-compassion, that can go a long way.
For sure. Another question that I really want to ask you, Doctor, is parents are finding it very difficult to cope at this point, but there's also this responsibility that they have of giving their children the right kind of information and saying the right things about what's happening right now, why they're all locked up inside their houses, why can't they go out. I really want to know, how can parents speak to their children and help the kids deal with the crisis while staying at home?
So parents know their children best, and I think that they need to factor in what they know about their individual child and also consider the child's developmental age and stage. Mm-hmm. So first and foremost, I always advocate for honesty, but less is more. We don't need to keep them up to date on every little thing, but we can explain to them, to whatever degree they're able to kind of comprehend and feel comfortable with, what is going on in the world. I think the most important thing, though, for parents is we need to be able to provide a safe and secure base for our children, because at the end of the day, at some point in time, this situation is going to be over, and what children are going to remember for the rest of their lives is how safe and secure they felt during this time on an emotional level. So we advise parents to check in with their children every single day, at least once, if not more, and just ask the very simple question of, how are you feeling? It's a great way to get our children to tune into their emotions and to express their emotions, and it gives us an insight into what's going on for them. And it gives us an opportunity to validate for them that whatever their emotional experience is normal, and that can also provide an additional opportunity for us to connect.
That's
the main thing that I would
valuable
suggest.
Piece of information that you've given us today, of just checking up on your kids and asking them how you're feeling. Thanks for that. Just reminding our viewers again that if you do have any questions, post them in the comments here on our Facebook Live broadcast, and we will be taking them up with Dr. Sarah. I've got another question from Priyanka, who says, how can we help people who have panic attacks? I think this is about providing support and help to the people who have these mental health disorders, but panic attacks specifically.
So if it's not you, if it's somebody around you, I always say that the best thing to do is for us to ask them, how can we help? Because it comes from a place of love and kindness and care that we try to help and support, but sometimes we're trying in a way that is not what the person in front of us needs. But if the person in front of you is willing and open to receiving support, or if it's you experiencing panic attacks, then one of the simple techniques that we recommend is something called grounding. Because when you experience a panic attack, what ends up happening is your mind is overrun with thoughts. You're experiencing a lot of fear, anxiety, and panic. You have a lot of things going on in your body. So physiologically, you're aroused and you're in that fight or flight mode. So you're very much plugged into what's happening internally. And a way to combat that is to shift our focus to what's happening around us. So we'll tell people, ground yourself in the present moment. Pay attention to several things in your environment that you can see, that you can hear, that you can smell, that you can touch, and that you can taste. And once you stimulate your senses, you get out of your body and into the present moment, and that can really help. So that's one of the things that we can do. And the other thing that we can do is also, when we're riding that wave, to remind ourselves that this feels terrible, right? It isn't a great feeling, but it will pass. And sometimes that can be something really, really valuable for us.
For sure. I mean, I think everything you're saying is very reassuring, and it's definitely very helpful for me and our viewers. But just moving on to the work aspect of it, I think more than COVID-19, the disease itself, one thing that has led people to getting all of these mental health issues and disorders is the repercussions that the disease and the virus has had on the economy in terms of unemployment, salary cuts, etc. And there's always been a correlation between, unemployment and mental health disorders. So I think that's one of the surges that's happened right now. At this point, at this juncture, what is it that companies can do to help their employees?
So one of the things I'd like to say, before I was saying that we have found that it's a busy time on an individual level, but I would say it's the busiest time for us when it comes to working with organizations. And it has been really reassuring as a mental health professional to be contacted by so many organizations asking us to help them help their employees. So there are so many different things that can be done depending on the objective of the organization. Sometimes it's about psychoeducation. So it's about providing webinars at this stage to teach people some of the tools that they can use to manage the main issues that we discussed previously. And then the other thing that can happen for employers who do not already provide mental health support as part of their insurance packages is setting up an employee assistance program. And so what that means is the organization will work with us, they'll partner with Thrive or whichever psychology clinic, and they will basically bulk buy sessions that their employees can use. And those sessions can be done online, and then when the situation changes, they can be done in person, either at the organization's offices, if that's what people are more comfortable with, or at the clinic. So those are the main things that people are approaching us for, and those are two things that can be very helpful on a broad level for promoting mental health and well-being and early intervention, but also for more specific people within the organization who are having more moderate to severe symptoms, or those who may have a mental health history already.
For sure, and this kind of brings me to mental health insurance. I think one of the reasons why people, one of the many reasons why people have stayed away from getting mental health help and approaching professionals for this is the fact that they think it's expensive and it's not covered in the insurance schemes. Would now be a time for companies to reconsider that, and insurance policies to also reconsider that by including mental health insurance in their schemes?
Yes, I think it's very important because especially now, and you said already that there are economic implications, and also when people are feeling stressed and anxious, sometimes what they end up doing is hoarding, and that can include hoarding their resources. So I'm really proud that within the community, the government has done a wonderful job of trying to provide access to free resources. And us at Thrive, we've also tried to offer a lot of things for people who may not be in the financial position to pay for services. But it would be wonderful if more employers implemented these programs that we were discussing and considered adding mental health as a core service, because we know that mental health is incredibly important for our longevity, our physical health, our well-being, but even from a corporate level, mental health, people who are struggling with stress in the United States alone, it costs organizations $300 billion a year. So it's not good for the bottom line, in addition to not being good for the individual employees.
For sure, we've also read reports about how untreated mental health illnesses has reduced the GNP of a country by 4% in the past. This was, I think, back in 2018, 2017. And there is clearly an economic implication of that. But again, just the other side of things is about how companies are monetizing on healthcare and mental health care right now in terms of wellness centers, of course, like yours, and there are startups like Quartet, which connects patients and therapists together, etc. There clearly is a business case there because there is a demand for it, there is a need for it, more than demand rather. So what would you suggest, and how would you say that companies and other startups can monetize on this?
I think the essence of it is offering a good quality service. At the core of our service and other wellness centers is individual therapy as well as couples and family therapy. So the best thing that we can do is continue to maintain having a strong reputation as people who provide a good service. And I think that something else that is really important is for organizations that are already established to recognize some of the parameters and the barriers that we discussed before, and to show the community that we are community focused, and that in addition to having all of our paid offerings, we are also giving access to people who are unable to take those up. So I think that's something that shows to the wider community that you actually care, and I think that goes a long way for your reputation, in addition to the fact that ultimately it helps a lot of people.
Right. Dr. Sarah, one thing I really want to ask you at this point is mental health still considered taboo here in this region, in the UAE? Are people still afraid to talk about it publicly? Are they afraid to approach professionals for help?
Mental health is still to an extent stigmatized worldwide. But what I can say is that in my observation, the stigma has been reducing on a global level, and even here in the UAE. I've been here now for about 7 years, and I've noticed an increase in the number of people who are talking not only about the importance of well-being, but also trying to normalize the experience of suffering or struggling with a mental health challenge. And a big part of that is going to be the fact that the government has really been prioritizing this, and by taking that lead, it has opened up a lot of doors for people to share stories. Do we have work to do? Absolutely, but things are really, really promising, and they're moving in the direction of being less stigmatized, which is a good thing.
I mean, it's only recently that, like we were talking earlier, that suicides have been decriminalized. I mean, that obviously is one step towards it. But at this point, have you seen a surge in those cases?
We are not seeing a surge in those cases. A lot of people all over the world have been speculating that suicide rates might increase following this COVID-19 pandemic. If we look at the data, there's evidence to suggest that following catastrophes, suicide rates can increase, but in some conditions and not in others. I think one of the things for us to bear in mind is that there are a number of risk factors when it comes to suicidality, and some of them include feeling hopeless, having low self-esteem, not having social support, and being unemployed. And this is particularly the case for males. And a lot of these issues and challenges are things that we are facing, and we are going to probably continue to face for a little while. Am I saying that suicide rates are going to increase? We don't know, but it's something important to remember. And I think for males in particular, we also know that often males will wait longer than females to seek support. And that is problematic because, as I said earlier, early intervention usually has better outcomes. So I think moving forward, one of the things that we need to do, suicide rates aside, is to really try to destigmatize seeking mental health support for males, and to normalize being able to speak about and share emotions as males, because I think that will have ripple and trickle down effects in a lot of really important ways.
Right, and why is it that men find it difficult to approach a therapist, for instance, and why is it that the suicide rates amongst men is higher than in women?
Men find it harder for a lot of different reasons, but if we think about the general gender stereotype, it's much more acceptable for a female to be considered quote unquote emotional and to share her issues and lean on other people. Whereas for men, there's this idea that they need to be strong and they need to be stoic. Yeah. And even if we look at the way that we raise children, and thankfully this is changing, but if we look at previous generations, some of the things that we would say to children would include boys don't cry. Yeah. So in addition to expecting them to be strong, we also have in the past shamed them for experiencing and expressing emotions. And so it becomes very difficult for them to do that when they're older. And a lot of times what men will do is they will externalize. So their emotions will come out in the form of aggression. Men are more likely to struggle with things like alcohol and substance use. So our socialization plays a big role in the health-seeking behavior. And some of the studies have also shown that from the perspective of doctors, I'm talking about family doctors and general practitioners who in other places can make these sorts of diagnoses, they are much more likely to interpret a woman's symptoms as being depression or anxiety than a man. So there are so many different layers to it that result in men having a delay in reaching out for support.
For sure. Yeah, I think we've gotten into a whole other topic right now. But again, it's just so important to talk about these things. We'll perhaps have another session on said topic. But today we just need to talk about the impacts of COVID-19 on the mental health of the people here in this region. You did mention some initiatives by the UAE government and authorities. Can you tell us more about that though? How is it that people can access these initiatives and take help from it?
So one of the things that the UAE government has done is they've set up an initiative called Happy UAE. And I had the pleasure and the honor of being one of the first speakers on that. And so what ends up happening is they have a series of experts who talk about psychological issues in both English and Arabic. And so people can access the past recordings of those and just kind of follow those accounts to see what is happening. But beyond that, as I said, there are a number of private places that are offering things, and there are a number of other government entities who have changed or added different services in order to meet the needs and the demands during this time. So there have been child protection and domestic violence hotlines that have been added as well, and a lot of different resources. So the government is really taking it seriously and being very proactive. And that is extremely encouraging.
For sure. Great. Thanks so much, Dr. Sarah, for joining us here. And thanks for all of those valuable insights. We've learned so much from you about mental health and mental health care in the time of COVID-19. Hopefully, we'll do another session a few months down the line with another topic. And hopefully by then, the situation has died down and we're out and about again. But thanks again for joining us.
Yeah, my pleasure. Thank you so much. And I would definitely be happy to chat again in the future. And I guess until then, stay safe and keep well.
Yes, exactly. You heard the doctor. Stay home, stay safe, and we will be back again next Tuesday.